For this lab, we'll be working on the neck of the calf specimen. So you'll be starting with the nuchal ligament, which in the calf can be a little difficult to get to, but you'll be going in the dorsal aspect of the neck here, and we'll actually just take a closer look at that and I can show you the nuchal ligament. Now we're looking at the calf from the caudal aspect of the neck here. And in the calf, the nuchal ligament is a little more difficult to get to. So I would recommend starting from the left side where you already have all of your muscles just as stumps, and then reflecting them towards the right side to get to the nuchal ligament. So here you have your cervical part of trapezius right here, and you want to just pull that up, and then you'll have the cervical part of rhomboideus as well, and you can just reflect those to the other side. That way you can open up this dorsal midline to get to the nuchal ligament. So here you can see the white part is the nuchal ligament, so this white line running down. And this part of the nuchal ligament is the funicular part. So that's running along the back of the neck here on the top part. And then if you find the midline in between the two sides, right and left, you want to try and split apart that funicular part of the nuchal ligament and then work your way down inside to see the laminar part. So if you spread those apart, you can see inside there's a laminar part that extends down toward the cervical vertebrae. So funicular part here, more superficial, and then the laminar part going deeper down inside the neck there. And now we'll take a look at the left side of the calf. Now we're looking at the left side of the calf. So this was the side that you took off the left limb. So we just have the stumps of some of these muscles to look at. And as I pointed out when we did the nuchal ligament, you have your cervical trapezius and your cervical rhomboideus muscles here. And then you also have serratus ventralis cervicis, which is this muscle right here. It's quite large in the calf. And then in between your serratus ventralis cervicis and your cervical rhomboideus, you want to look for the splenius muscle. So that's this muscle right in between those two, right there. Then you also want to look for the stump of your brachiocephalicus muscle. So that's here. It's been cut, obviously, to remove the limb. And the brachiocephalicus muscle has the cleidocephalicus, so meaning the part going from the clavicle to the head. So cleidocephalicus would be this part. And the cleidocephalicus in the calf has two parts, whereas the pony only had one. So in the calf, we have the cleidomastoideus, which would be this part. And then the cleidooccipitalis, which is going to go up closer to the back side of the head here. So cleidooccipitalis, cleidomastoideus, both are part of cleidocephalicus. Then you also want to see the omotransversarius, which in the calf is a separate muscle. In the pony it was fused to brachiocephalicus, but in the calf it's separate. So if you reflect the stump of your brachiocephalicus, you can see your omotransversarius muscle right underneath there. The calf also has an omohyoideus, but it's not very significant. I'll just point to where it is in case you see something and are wondering what it is. So omohyoideus would be in this area, but it's just very thin and not very significant in ruminants. Then you also want to see your external jugular vein here. And then you want to move just cranial to that, and you want to find your sternalcephalicus. So sternalcephalicus extends from the sternum up toward the head, and in the calf it has two parts. So you have the sternalmandibularis, which will be the part you encounter first in your dissection here. So sternalmandibularis, and then you have sternalmastoideus right here. So sternalmastoideus, sternalmandibularis, both part of sternalcephalicus in the calf. Okay, then if you reflect that, you can actually see quite a bit of cervical thymus. So this is something that's significant in the calf and different from the pony. So all of this tissue that you see here is thymic tissue, and this is cervical thymus. So you definitely should know that in the calf. Then as you get closer to the midline, the ventral midline here, you'll have your sternohyoideus and sternothyroideus muscles. And again, they have that common origin from the sternum. They start together, and you can separate them out as they start to separate into left and right sides. So you have sternohyoideus and thyroideus here on the left side, and hyoideus will be the most ventral one here. And then sternothyroideus is actually going to go off just slightly laterally and will actually go up toward the thyroid cartilage of the larynx. So sternothyroideus here, sternohyoideus there. Then you have the trachea that you can see here. So here's the trachea, and you also want to find, if possible, some of the deep cervical lymph nodes. So here I have a cranial deep cervical lymph node, little one right there. And here I had some small middle deep cervical lymph nodes as well. And then I need to show you the carotid sheath. So if you kind of have to work around this sternocephalicus muscle here in the calf. It gets in the way a lot. And here I'm just going to pull out. So this fascia surrounding my carotid artery and vagosympathetic nerve trunk is the carotid sheath. So once you open that up, you can get inside and see here's the vagosympathetic nerve trunk, and this is the left common carotid artery inside that carotid sheath. All right, then also in the calf, I'm not sure if I have any right here to show you, but you look for hemolymph nodes. So they're different than the regular lymph nodes. Here's a couple little ones if you can see them there. There's a little round dark spot here and there and there. And those are hemolymph nodes. So you can look for these as you dissect the calf, and they are kind of scattered everywhere, but they're just called hemolymph nodes, little dark spots. And we'll take a little bit closer look at this region and see the deep cervical lymph node, and then also try and see the thyroid gland. Now we're just taking a closer look at this region, and I have to reflect this cervical thymus, so you'll have to kind of work around that and just move it out of your way, because it will be in the way quite a lot. And here you can see the trachea that we saw, and right next to it you can see the esophagus. So right here is the esophagus. And then that deep cervical lymph node, so you have the cranial deep cervical lymph node right there. And if you keep going up towards the head and spread these muscles apart, you can see the thyroid gland right there. It's a darker color than those lymph nodes. That's the thyroid gland there. And now we'll take a look at the right side of the calf. All right, now we're looking at the right side of the calf. So this side still has the attached limb, so some of your muscles are a little more intact on this side. So we'll start with the cervical trapezius, which is right here, and you'll reflect that. It's already been cut, but you'll just reflect that off of this area. And then you have the cervical rhomboideus muscle here. So cervical rhomboideus. And then you have serratus ventralis cervicis, which is this portion here of the serratus ventralis. Then in between your serratus ventralis and your rhomboideus, you have the splenius muscle. So if you just separate those, you can see the splenius right in between. Then you have the brachiocephalicus muscle. So here you have the brachiocephalicus intact on this side. So the brachiocephalicus has several parts, and we're looking at the cleidocephalicus part. So it'd be from here towards the head. And so the calf has two parts. You have the cleido-occipitalis, which is going to be the wide part going towards the back of the head, right here. And then you have cleidomastoideus, which is going to be this part right here. So if you can, separate them out. If not, just know that the more cranial part is the cleidomastoideus, and the more caudal part is cleido-occipitalis. And those are part of the cleidocephalicus, part of the brachiocephalicus. Then underneath that, we have the omotransversarius, which in the calf is that separate muscle, and in the pony it was fused to brachiocephalicus. So here in the calf, we have omotransversarius right here, and you'll want to transect that, basically just straight across, and reflect it to see that very large superficial cervical lymph node underneath. So it's very large, hard to miss. And so you should see it right after you cut your omotransversarius muscle. It should be right underneath. Okay, so then you want to look at the external jugular vein here. It's nice and big. Should be able to find it pretty easily. And then you're looking for the sternocephalicus muscle. So sternocephalicus, right here in the calf, has two parts. In the pony, we only had one, but in the calf, we have two. So the first part is the sternomandibularis muscle right here. So sternomandibularis, and then we have sternomastoideus is the other part in the calf. So sternocephalicus is both parts together, made up of sternomandibularis, sternomastoideus. Then if we reflect the sternocephalicus, we can see the sternohyoideus and thyroideus muscles. And those are midline, so they have a common origin, and then they split apart into left and right. And here on this side, my sternothyroideus muscle has been ripped apart due to a previous surgery on this animal. So here we have sternohyoideus that will be intact coming up towards the head here. And then my sternothyroideus is kind of broken into pieces right here, but goes slightly off to the lateral side. So sternothyroideus here, sternohyoideus there. Then you can see right underneath the sterno muscles, you have this cervical thymus. So all of this tissue is thymic tissue, and it's the cervical thymus, which is important in the calf. That's different than the pony. And if we reflect the cervical thymus, you can see the trachea. So here's the trachea. And if you can find some, you can look for these deep cervical lymph nodes. Here I have a cranial deep cervical lymph node right here. And sometimes they're really difficult to find, but they're just regionally named, so you'll have cranial, middle, and caudal that could be along the trachea there. So you can look for those. And then we can try and take a closer look at the thyroid gland. Now before I move on to the thyroid gland, I just want to point out here is my carotid, well, it would be my carotid sheath, the fascia surrounding these two structures, but this is the carotid artery, so right common carotid artery. And then we have the vagosympathetic nerve trunk, so right vagosympathetic trunk on this side, running right alongside your carotid artery. These were pretty deep down in there. They can be hard to get to sometimes in the calf with all of this cervical thymus in the way. And now we'll just move up towards the head here and try and take a look. So you had that deep cervical lymph node, this little guy right here. And then cranial to that, if I push these apart, you can see this little piece of the thyroid gland. So we're just seeing part of it, but it's right there. That darker colored tissue is the thyroid gland.